API Wellness began 30 years ago in response to the HIV epidemic here in San Francisco in the Asian and Pacific Islander communities. What was not happening was that communities of color were not getting culturally and linguistically competent services. And so API Wellness was born. In addition to HIV services, prevention, care, testing, and treatment, we've provided substance abuse services. We've provided mental health counseling. We have a drop-in program for the homeless community of the Tenderloin, for the transgender community of San Francisco. We offer hepatitis and other health screenings, and we do outreach in the community. And in 2015, we were awarded a Federally Qualified Health Center Award. We were the first organization in over 30 years to receive this designation in the city of San Francisco. And so what it means is that we are federally designated and mandated to provide healthcare services to low-income individuals and communities and homeless individuals right here in the Tenderloin. We have always known that partnership and collaboration is part of what it means to be successful. We can't do it on our own. When we're taking the risks that we do, part of our intention is to make sure that we're collaborating with other organizations. And San Francisco is filled with some amazing community-based organizations.
We have a long-standing partnership that is very deep and rich with API Wellness Center, and the most recent and visible piece of that collaboration has really been the clinic that we were able to build out at the center and the services that API Wellness Center is currently offering and will be offering there. So that's really exciting. We don't, at the center, we don't do healthcare ourselves, and we don't work on direct wellness programs, so I think that this is an opportunity to really look at how we better and more visibly partner around health and wellness provision.
Our organizations partner significantly, particularly around an amount of statewide trainings that we do. They are benefits counseling trainings and HIV prevention trainings, where we go around the state and help service providers educate them on what is new that's happening at the federal, state, and local level. This is critical information for the service providers as they meet with their clients and make sure that they are providing informed information so that they can make the best choices for their health and their health care.
API Wellness Center is celebrating its 30th anniversary, and it's been in the community for a long, long time. So if we have clients, that lived in the Tenderloin area, north and south of Market area, and that needed some specialized services because they're Chinese or Filipino or Korean, then we send them to LANS. We send it to API Wellness.
The API community historically has always reached vulnerable populations, and particularly as we are trying to get to zero on HIV and AIDS, it is so important for vulnerable populations and populations of color to have access to medical care and social services and other supportive services. They do reach the populations that even government cannot reach. And so that is why we support them, and also the fact that I believe the federal government recognized their role with the LGBT community and particularly the transgender community.
What I love about API Wellness is that we have always taken risks. And I feel like that's what it takes for an organization, and particularly HIV organizations serving communities of color, need to take risks so that we can survive and that we can push through some challenging times, whether it's funding, whether it's healthcare policy or immigration policy, and adapt and change and transform. And so when we look ahead, we have always been transforming, and this is our newest iteration of our transformation, and it's time that we look ahead, we look at rebranding, we look at changing our name. API Wellness has been a wonderful brand for us for the past 30 years, but it has held us back in some ways. I've had some clients tell me recently that they actually didn't realize for several years that they could get their medical care with us, because they weren't Asian or Pacific Islanders. And when I heard that really was clear that our name was not doing justice and serving all of the communities that we are here to serve. And so we went through a very intentional and thoughtful process that involved board members, staff, and we came upon the San Francisco Community Health Center because we felt like that doesn't take away our commitment from the API community. San Francisco is an API city. San Francisco is a people of color city. San Francisco is the LGBT Mecca for around the globe. And so all of that is what we feel San Francisco embodies and why we have chosen very intentionally to have San Francisco front and center in our name. San Francisco Community Health Center will always be there to provide care for APIs, for people of color, for the LGBT community, and for anyone on the outside who needs to be front and center. And that's who we're committed to, the queerest among us always.